One is a result of the autoimmune disease. Like in this case, there is bleeding, there is mucus, there is discomfort, pain, all these things are happening, right? The other part of that is the underlying reasons of why it started in the first place. So you have the result of the imbalances and then the causes of the imbalances. So in my opinion, when I start treating patients, I'm addressing both sides of it because then you can get there faster.
Welcome to the Radical Health Rebel podcast. I'm your host, Lee Brandon. This work started for me several decades ago when I started to see the impact I could make on people, helping them to identify the root cause of their health problems that no doctor could figure out, including serious back, knee, shoulder and neck injuries, acne and eczema issues, severe gut health problems, even helping couples get pregnant after several IVF treatments had failed. And it really moves me to be able to help people in this way. And that is why I do what I do and why we have this show. Dr. Anju Mathur, it's great to have you on the Radical Health Rebel podcast. Thanks for joining me today.
Thank you very much for having me.
Yeah, it's a pleasure to have you here. And to start us off, could you tell us a little bit about your background, like where you studied, your journey through your career, and what led you to work with people with inflammatory bowel disease?
Oh, well, I am a medical doctor. I went to medical school in New Delhi and I graduated from there and I was in the middle of residency. In fact, I was doing OBGYN residency. And then I decided that this was, in fact, it was nothing to do with medicine. It was more like philanthropic. And I was like, I need to find solutions like about people. Why are people so unhappy and restless and, always in a lot of conflict? And it was actually in the middle of a strike. There was a strike in the hospital I was at. And I just thought it was not fair to the patients for the medical residents to just take off and not serve the patients that depend on us. So I kind of left India in the search of answers to life. I landed in California, in fact, in the Northern California when I arrived. And then I got into residency in LA. And I did that and then started practicing back in 1992. So it's been a while. And I was doing conventional medicine. As you can imagine, I was an MD. So I was doing conventional medicine just like any other mainstream doctor. But then very quickly I realized that I wasn't really helping people, that it was really a superficial bandage sort of thing that I was doing. And what they call in medicine is called management. So you kind of manage the disease. It had nothing to do with actually making the person feel better in terms of more long-term stability instead of depending on medications, drugs that have so many side effects. So I actually, it's a funny story because I was almost ready to give up medicine. And I thought, you know what, I'll just change my career. I don't really need to be a doctor and pretend that I'm actually helping people when I'm not. And luckily for me and others, I got invited to an anti-aging conference in Beverly Hills, California. And as I entered and I saw this room full of doctors, but they were very animated and very, very happy to be talking to each other. And they were super excited. And I thought, wow, this is a different scene. Because normally when you go to continuing medical education, you go to conferences, people are pretty kind of wrapped up, very serious, and they are just trying to get in, get out. They're not really interested much into what's going on. So this conference was pretty different, and I realized that, and I'm like, wow, this is different. So let me find out what's going on. And it was about bioidentical hormone replacement therapy. And at that time, I didn't even know what bioidentical meant. And it was a completely new idea for me. And I said, okay, I learned this. And I spoke with the speaker. And he told me, yeah, he was, I think at the time was 49. And he said, yeah, he's doing all of the stuff that he's talking about for himself. So by just looking at him and seeing how animated and excited he was, and I said, you know what, there's something to this. I should learn it. And that's when my whole alternative holistic medicine career began. And from there on, I converted I converted my practice overnight. Literally, it was overnight. I decided that I was going to go alternative route. And the first thing I researched after the bioidentical hormones, I kind of put it on the back burner. I said, okay, that's good. But I needed to find out. In fact, personally, I was not doing well as a human being in terms of my physical body. I wasn't happy with that. It was very, I couldn't even sleep for like months. I was having trouble sleeping. And as a result of that, I had no energy. And throughout the day, I would just kind of have to lie down for a couple of hours, get up and do something, then go lay down. It was kind of really annoying. And I was only like 41, 42 years old. So I thought there was something really going on that I'm not aware of, that as a doctor, all my tests were normal. And I saw many, many practitioners, and they just said, there's nothing really wrong. It's, just maybe a little bit this, a little bit that. And I kind of tried lots of, even including alternative practitioners, and they would tell me something or the other, but nothing really resolved anything. And then I thought, okay, I'm going to look into nutrition, because that just made sense that there will be something wrong nutritionally with the body, and that could be changed. So I started researching on nutrition. And again, one after the other, I tried many, many different things, many diets, many supplements, not even so much diets, but supplements. People, it's funny when the nutritionists are practicing nutrition, they are really practicing supplementation, because they just keep, prescribing the supplements. So somehow, like magically, the supplements are going to do something when you are that down the hill with your health, right? So I learned from lots of different places. And one of the things I learned was about metabolic typing, as I was discussing with you earlier. And so I had chats with Bill Walcott, and I started applying the metabolic typing. And the one thing I realized as I was doing it was that I was kind of stable at this point. I wasn't kind of going up and down or anything like that. I was more stable. And I said, okay, there is something to this. I'll keep doing this. And I realized at that point that my health had improved, but it only improved about 30%. Even that is better than nothing, right? It's better than 0%. So 30% was good. So I kept doing it. And then one day I did a liver cleanse. And you have to imagine a medical doctor who has never heard of a cleanse, has never been taught a cleanse, let alone even speaking about it. So that was kind of a strange idea to me, to do a liver cleanse. But then with my nutritional advisor that was helping me, June at that time, she told me, Anju, you should do a liver cleanse. And that was about a year and a half into the metabolic typing. So I did the liver cleanse, and lo and behold, it completely changed how my body was behaving. And I was so sick during the cleanse, and I was like, no, sickness, but in a good way. I was kind of coming out of the sickness. It was almost like you're coming out of the flu type syndrome, right? And for the whole day, I was in my chair and just sleeping and eating and sleeping. But the next day, 24 hours after my cleanse, I was like a new person. Like I couldn't believe how much energy I had, how much better I felt about myself. So that was the turning point. That's when I pivoted completely from mainstream into alternative. And I thought, it'll be not good for me to not tell my patients or share with my patients what I am doing for myself. And that would not be fair. So next day when I arrived at the office and my first patient, I told him what I was doing. And he was so excited. He said, Doctor, tell us what you're doing, because I want to do what you're doing because you look so much better. And that's how my journey began. So little by little, I did many, 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 many things. You asked me the question about the ulcerative colitis. Now, ulcerative colitis is an autoimmune disease, right? So we all know that it's an autoimmune disease. It's not literally the effects of the manifestations of it is in the gut, in the small bowel and the large bowel, but the underlying causes of it is what we address. So Because I'm doing alternative medicine, many patients came to me asking for solutions for their long-term health problems. And I realized the ulcerative colitis was one of them. But my concept was, I'm not going to treat directly the gut. I'm going to treat the immune system. And that's what I started doing. And that gave me such satisfactory results, let's put it this way, satisfying to me and to the patient. And so I kind of evolved from there into autoimmune. So I consider myself a specialist in autoimmune diseases. And any kind of autoimmune you might have, I will be able to help improve the situation and improve the condition of the body.
Mm. Yeah. So, we're going to talk a bit more about inflammatory bowel diseases. And as you said, they are considered autoimmune conditions. Just from a basic level, and for anyone new to the topic, how would you explain what an autoimmune disorder is?
Amanda spent 19 years battling severe IBS, diarrhea, and abdominal pain. Her life was ruled by public toilets, and she avoided holidays for fear of flare-ups. Doctors offered no solutions, just endless Imodium. After working together, Amanda discovered the root causes of her symptoms, and in just 3 months, she was IBS-free. She even booked her first holiday with her husband, a dream come true. If you're struggling like Amanda, visit www.bodycheck.co.uk to schedule your consultation. Let's find the root cause and get your life back.
Right. When in simple words, literally the autoimmune disorder is when the immune system fails to perform what it needs to do in order for it to protect the body, from pathogens, internal, external, other stresses, even like chronic stress or whatever it is, the challenges that our body faces. So immune system is supposed to protect us from all those influences that are external to the body. But when the autoimmune disorder is there, basically that just means that the immune system kind of failed to perform. And I just say like a guard that's standing at the door, but it's on vacation, right? It's not doing its job. And so instead of doing not its job, it's doing now the opposite, which is invading and affecting the tissues and attacking the tissues in a way that causes pathology. In ulcerative colitis or inflammatory bowel disease, you have the organ that is affected by the autoimmune condition is the small bowel and the large bowel. So that's really what happens. So literally, you can have an autoimmune disease and your manifestations could be different depending on the way I feel about it is because the part of the organs in your body that are more susceptible to the attack is what is going to be attacked. And of course, it depends on genetics, lots of different things, your family history, different things, what has been running into your genes, as well as the manifestations of the genes and things like that will affect particular part of the body.
Yeah, that's great. I know some people get confused between irritable bowel syndrome and inflammatory bowel diseases.
Yes.
Could you break down the difference for the listeners in relatively simple terms?
For sure. Irritable bowel syndrome, IBS, that just means that your bowel is kind of irritated in the sense that it could be affected by any kind of stress, whether it's physical, emotional, psychological, and you can go into either constipation or diarrhea. That's the irritable bowel syndrome. It's very different from inflammatory bowel disease. That is a pathological condition where there are ulcers in the small intestine or the large intestines. They actually are ulcerated. The mucosa is ulcerated, so then it will bleed randomly or at any time with a bowel movement or not. But you can have bleeding. So that's inflammatory bowel disease. It's so different from irritable bowel syndrome because irritable bowel syndrome mostly is, there's also a lot of other underlying causes that could cause it, but mostly stress related and psychological impact on the gut.
Mm-hmm.
Yeah.
Yeah, I know SIBO is often, I think I'm right in saying that around 70% of IBS conditions could be classed as being SIBO in terms of the causation.
Yeah.
But then what's caused the SIBO? Could it be mental stress? Could it be, the foods? Obviously, we know it can be a physical blockage in the intestines as well. But yeah, the difference between the two is quite vast, although I believe I'm right in saying that in some people, the symptoms might be similar, right?
The symptoms might be similar. You can have diarrhea all day long, or you can have constipation. But usually with ulcerative colitis or inflammatory bowel disease, you will have some bleeding, or you can have some mucus coming out. But there's one test, maybe I should just say that so people can understand, maybe they'll use it. There is a test that differentiates the IBS from IBD, which is inflammatory bowel disease, and it's called calprotectin. So if you have a calprotectin in your stool test and it is over 50, you have inflammatory bowel disease. If it is normal, then you could be labeled. There is no real test for IBS. There's no real test for IBS. There is no diagnostic workup that could be done. It's a diagnosis of exclusion, which means there is no other problem. So they label it as IBS because it's psychological. So there is no real testing that has been done for IBS. So this is why I gave you this calprotectin, so that way you can see whether you have IBD or IBS.
Yeah. Yeah. And is there other, what's the right word, diagnostics that medical doctors tend to use if calprotectin is higher? Do they do further testing?
Yes, absolutely. I mean, if your calprotectin is high, the suspicion for IBD is high, but the diagnosis is made with colonoscopy. So you have to go see a gastroenterologist and schedule yourself for a colonoscopy. And that, of course, before you do the colonoscopy, you'll do the full stool test, right? Besides the calprotectin, you have to do the full stool test. But the actual diagnosis can only be made by pathology, which means that you need a tissue diagnosis. And that's when you do the colonoscopy and they take samples of your colon and then they put it under the microscope to see what pathology is there. And that's how they diagnose IBD.
Mm. What's your view on colonoscopies? I know a lot of doctors have, let's say, issues with colonoscopy. What's your views on colonoscopies?
I mean, personally, if you ask me, obviously it's pretty uncomfortable to get colonoscopies, but it's a standard medical care is that if you're over 50 years old, then you are supposed to get a colonoscopy every few years, 3 to 4 years or 5 years, depending on the gastroenterologist's opinion at the time that you see him. But personally, I think there is, if you are thinking about, when you do colonoscopy, you're also trying to rule out cancer, colon cancer. So there is another test you could potentially do to rule out not the IBD, but the colon cancer. And that is called Cologuard. And that Cologuard is being offered in the U.S. And it is, I think it's pretty dependable. I mean, it is accurate most of the time. And it is, it's a screening test. It's not a diagnostic test. It's a screening test. So you could do the Cologuard first and see if it is negative. If it is negative, then you can relax and not need to do colonoscopy. But in order for you to diagnose IBD, yes, you do need colonoscopy. And that is where they can see with the scope your ulcers inside your colon. So that is more like confirmation of your, suspicion. That you are suspicious you may have IBD, but to confirm the diagnosis, you need colonoscopy.
Yeah. Are there any negative connotations, in your opinion, to having a colonoscopy?
Yeah, I mean, they could be. You have to drink this drink called Golightly, which is kind of disgusting, but most people don't like doing that. They can't drink that whole 2 liters of Golightly. And then there is anesthesia involved, right? So you can, some people do it without anesthesia. I have a gastroenterologist that I use that can do the colonoscopy without anesthesia. But most people need anesthesia or sedation. So if you are avoiding drugs, then, this is kind of, you have to think about this thoroughly, see if you really need it. And if you really need it, yes, you can do it.
Yeah, I do remember reading an article by Dr. McCullough many years ago, and he was kind of outlining all the potential pitfalls to having colonoscopy. I can't remember what all of them were, but I think one of the things he was saying is that they're quite hard to clean effectively. He was saying, which I guess would potentially cause a bit of a problem. I know a client of mine recently had a colonoscopy. She does have a history of ulcerative colitis. And following the colonoscopy, she had all kinds of symptoms that broke out immediately afterwards, like eczema and fatigue and, quite severe eczema as well.
Wow.
And you just think, well, if you're messing around with the microbiome by shoving things in there, maybe that could potentially cause a problem. Maybe it was just the stress of the procedure, maybe. But I guess like any medical intervention, you've always got to weigh up the risks and the benefits, right?
Oh, for sure. There is even a risk of rupture. I shouldn't say that to scare people, but literally there could also be a rupture. If it is not done correctly, then you can have bleeding as a result of colonoscopy. And you can have a rupture of the ulcers if it is not carefully scoped. Mistakes can be made in anything. Even driving a car, you can get into an accident.
Yeah. So, big question for you, because again, you will probably back me up on this. It seems that when someone has, inflammatory bowel disease, there's very little advice given by medical doctors on nutrition, right? So, from your perspective, how much of a role does food play when it comes to IBD? Like, how much of a difference can diet really make?
Meet Julie, a 47-year-old working in computer sales who had been battling lifelong IBS. She suffered from severe abdominal pain, bloating, and frequent loose stools, low energy, brain fog, and hot flashes, all of which affected her work and quality of life. After thorough testing, we discovered the root causes: parasite infection, bacterial overgrowth, leaky gut, low digestive enzymes, and a vegetarian diet high in oxalates. With a tailored plan, Julie made dietary changes, added targeted supplements to balance her gut microbiome, and supported her digestion with prebiotics, probiotics, and enzymes. The results? Well, in Julie's words, the improvement is staggering. Her pain and bloating vanished, her energy levels soared, her brain fog and hot flashes disappeared, and her immune system became stronger than ever. If you're struggling with IBS or gut health issues, reach out today for a consultation at www.bodycheck.co.uk, and let's uncover the root cause and create a plan to transform your health.
Okay, so let me give you an analogy, the way that I explain to my patients. When you have autoimmune disease, there is two problems. One is a result of the autoimmune disease. Like in this case, there is bleeding, there is mucus, there is discomfort, pain, all these things are happening, right? The other part of that is the underlying reasons of why it started in the first place. So you have the result of the imbalances and then the causes of the imbalances. So in my opinion, when I start treating patients, I am addressing both sides of it, because then you can get there faster than slow. You can get there, but it might take years for you. And that sometimes is difficult for some people to wait that long to get to see any result. So in my practice, I want to make sure that the person sees the results faster than later, because they're already pretty disheartened for so long, seeing mainstream doctors one after the other and being put on drugs and not really resolving the underlying issue. So the food, like you asked, the food is obviously the key part of handling inflammatory bowel disease because it's whatever you're eating is going straight into your gut. So if there's going to be a bad effects of the food, it's going to be felt immediately in your gut. So if you eat, for example, what I have seen now, you are in UK, so maybe it's different. But in the US, I would say 99% of wheat is GMO'd. And it's unfortunate that the wheat is GMO'd. And so that causes a reaction in the person's body. And that is an autoimmune that could lead to an autoimmune reaction. So immediately taking people off of gluten is what I do. It's the first thing you can do. If you do nothing else, just take yourself off. You will feel some certain amount of relief. It may not handle all of it because, like I said, it's only one part of it. The causation of it, the food allergies or food sensitivity is one part of it. There is many other parts of autoimmune disease. And they all work together to create this horrendous overall effect in the end that you are bleeding 5 times a day, you have humongous amounts of mucus, you have discomfort, you have pain, you can't eat food. It's just all these different things are the end result of the other parts that have caused the problem to occur in the first place. So food absolutely is very important. And there is also, when I explain nutrition to people, I usually say this. There's two parts to the equation of nutrition. One is you need to find out what is the right food for you, right? Based on your genetics, based on your external, the phenotype, whatever, there is some certain amount of genetic requirements of your body. So that is what is going to nourish your body because the food is eaten so you can get energy. If you eat food and you feel tired, obviously you're eating the wrong food. It's pretty obvious. But the other side of the equation, so let's say you're eating all the good foods for your body, but the other side of the equation, which most people kind of don't really look at, and I do this routinely, is that I want to find out what are your food sensitivities. So even if you have the correct food that you're eating, but your particular body could be sensitive to it. So if it is sensitive, then even if it's the right food, it's not going to help you because now it's going to elicit an immune reaction. The immune system is going to attack the food because there is an allergic reaction. So there is also source of how the immune system misbehaves, so to speak. There's many, many theories. There's many studies done for why it occurs. There's many, I can go into that if you want me to do this, but I can do it. There is something called molecular mimicry. And that means that, for example, you have either the food, for example, food, let's say gluten or gliadin, right? The immune system thinks that gliadin is same as a colonic mucosal cell because of the molecular mimicry. So humans are basically on the chain of all the other species, right? We all things that are alive, they share certain antigens. We share certain antigens. So you have, let's say, gluten or gliadin or whatever it is that you're allergic to, then the body is kind of thinking that, like, for example, brain cell. So you eat gluten and you get headaches or you get mood swings or you get upset or you get depressed or different mental manifestations can occur. And that is as a result of the molecular mimicry. So the immune system thinks the brain cell is the same as a wheat cell. And so it attacks the brain cells instead of the wheat. So even if you don't eat wheat, the body is thinking the brain cells. So this is why there is an autoimmune reaction to that. And that causes inflammation in the brain. People get headaches. People get, moody. They can get temperamental. They can do whatever. Irritability. You see a little kid running around and you give them a toast or something or a cookie that's made with wheat. And then you can see the temper tantrums coming out of the kid. So it's not the kid's responsibility. It's the parents to see, okay, what is he eating? So food, absolutely. I say this, without the food, there's no foundation to your health. Literally no foundation for anything, not just ulcerative colitis. You can have any disease, multiple sclerosis, for example, or even dementia. You need to have the correct food for yourself, and that's super, super, super important.
Yeah, for sure. So do you do food sensitivity testing?
Yes, I do food. We call it food allergy, even though it's a different allergic reaction. So people say, "Oh, I know what I'm allergic to. I don't need to test." Most patients don't say that, but some patients do. But the difference is this: when we are doing blood tests, we're not doing a scratch test on your back, right? We're not doing that. That's dermatologists. That's what they do. We don't do that. We are checking blood, and the blood has an antibody called IgGs. And so we are checking the IgGs and the IgAs to the different foods. So there's different food panels. You can do 96 food panels. You can do 200. You can do different cuisines. You can do lots of options are available. Like if you're Asian, you can check only the Asian foods. Whatever that you are eating, you can test those things. But the difference is when you're doing the food allergy test in the blood, what you are checking for is called IgG, and that antibody takes about 3 to 4 days to develop in the body. So it's a delayed cellular hypersensitivity. It's not immediate hives and you start choking. That's called anaphylaxis. And that is a different antibody. It's the antibody for anaphylaxis is IgEs. So we are not testing those. We are testing for delayed cellular hypersensitivity. So when you're doing that, because if it's going to take 3 to 4 days for you to get the allergic reaction, whether it's in the form of blood in the stool or it's in the form of hives or in the form of eczema or your nasal allergies or your headaches, it will take 3 to 4 days. So most people can't remember what they ate 3 days ago. And so this is why it's a good idea to test for your food allergies. So then you can see, like I'll give an example of a patient that was only 8 years old. And the mother, who was a dentist, brought the little girl to me. And she had rheumatoid arthritis, this little girl, 8-year-old. And she was fat, she was obese, and her joints were so swollen. She couldn't even walk, or she was just 8 years old. So I just did her food allergy testing. We just had to poke her once, and we did his also. I know we haven't talked yet about metabolic typing. So I tested her for those two things. And then when the results came back, I went over those results with the patient herself. And I asked her, okay, do you think, you could do this? If I ask you to do this, would you be able to do this? Because it's going to help you with your joint pains. And she immediately said, absolutely, yes. And girl was very smart, very, very beautiful person. And once she understood what she needs to eat and not eat, 2 months later, I got this picture of the girl the mother sent me. And she had lost the extra pound. She was skinny. She was dancing away. No joint pains, no inflammation. So the answer to your question, absolutely yes.
Yeah, gluten is the one that I think most people think about, don't they, when they think about immune responses or damage to the gut specifically. Are there any other foods that spring to mind that you tend to find related to IBD conditions other than gluten?
I will tell you what I most commonly find when I'm doing a food allergy test. Dairy is one of them. But remember, this is US. So when the patients go to Europe for vacation, I usually tell them you can eat anything you want. It's not the same as in the United States. Unfortunately, the food is pretty GMO'd here and pretty processed, chemicalized. It is hard to find good food. Unfortunately, this is the most prosperous country, but unfortunately, the food supply is not as good as it could be. And so we have the commonest one is dairy, and then there is gluten. Gluten is very common, and then you have eggs. Sometimes people are allergic to eggs, and that makes them the most saddest that I've seen. The response when I tell them, you have eggs allergy, and they like, oh gosh, and they're like, they kind of hate it. I'm like, okay, if you want to go eat eggs, go to Europe. You can eat eggs. And also another one is common is almonds. Almonds are also very common, and sugar, 100%. Sugar is, so many people are allergic to sugar and they eat sugar every day. And it's just not good. I think the sugar, especially the processed sugar, is the one that's a problem. So white sugar, processed sugar, not good. And that's pretty much the common ones. But then, of course, we have all types of vegetables, fruits that people are allergic to. Grains, like oats, very commonly people are allergic to oats. And so that's what I find. But I still do the testing so they can see for themselves what it is that they are allergic to.
Mm. Yeah, I guess things like seed oils and vegetable oils possibly aren't great as well.
But yeah, I think if you really look at it, the food that is available in nature, it was made by nature for the consumption of humans. But the reason that, this is what I tell them, I said, look, it's not that the fact that dairy is bad, because it's not. It's not the fact that the wheat is bad. No, it's not. It's the way it is processed and the seeds that are used to grow the crop is the problem. So this is why when you go to Europe, when I go to Europe and I go to Italy and I'm eating pizza, never a problem. So it's just a processing.
Yeah. Yeah, I do think also when you go on holiday, your stress levels have reduced.
That's for sure.
I think that helps as well.
Yeah.
So I know some people explore intravenous therapies for IBD. Do you think they can help in your experience? And if so, how do they actually support the body?
Are you tired of just managing your chronic pain and ready to start actually overcoming it? I've created a powerful free guide called the Chronic Pain Breakthrough Blueprint, designed to help you uncover the hidden root causes of your pain and give you practical, holistic strategies to finally feel like yourself again. Whether you've been in pain for months or years, this guide will help you start asking the right questions, identify overlooked triggers, and take back control of your health one step at a time. It's completely free. Just hit the link in the show notes to download the Chronic Pain Breakthrough Blueprint today and take your first real step towards lasting relief.
Right. Yeah, intravenous therapy is the way to go. That's what I use in my practice for autoimmune conditions. And depends on what the person is going through. There's too much stress in their lives or what is exactly going on. So what I do is we have over 3 different dozens of IV therapies. And they are mostly oxidative IV therapies. So they do improve the oxidation reduction in the body, which is basically the free radical scavenging and redox reactions, which are basically communication between different cells, signaling systems. So what I do is that I feel like, I don't know if you've heard of a treatment called UBI.
No.
Okay, it's called ultraviolet blood irradiation. I find that that's the most effective for IBD. And the reason for that is the UBI, like I said, any treatment that I do is oxidative treatment. But what happens is that the UBI is, the way it works is that it's optimizing your immune system, right? It's scavenging the free radicals, for sure. It's increasing oxygen levels. And then in my mind, let's say we didn't go over what are the causes, but I do explain the causes of autoimmune, and we kind of investigate all those causes to see what is in that particular person present. So that molecular mimicry I was talking about earlier also applies to that in terms of something called, for example, viruses. People have viruses in their body for long term, even though they say, oh, it's chronic, it's nothing new that's happening. But there is something called reactivation. And we may not have the perfect test to test for reactivation. So what we test all the different antibodies for the, let's say, EBV, mycoplasma, cytomegalovirus, parvovirus, different types of viruses that we are checking for. And if the titers are pretty high, I assume automatically, and the patient has symptoms, then that means that their virus is reactivated. So what we want to do with the UBI is we want to denature the viral DNA. So that way it doesn't replicate. It doesn't divide and multiply. So that's the first thing. So it's like controlling something that's leaking, and we want to stop it from leaking. So first thing is to stop the multiplication of the virus. And then what happens is when the denatured DNA virus goes back. So what happens with the UBI is we take out a small amount of blood, and then we mix it with the saline solution. And then that blood and the saline solution mixture goes to a machine where it gets exposed to UV light A and C. And then that blood, once it is exposed to the light, goes back in your body. So when it goes back in the body, it's activating your immune system in various different ways. But one of the things that I love about UBI and using UBI for autoimmune is that when the denatured viral DNA goes back in your body, then it kind of retrains the immune system. The immune system now sees, okay, this is what I need to attack, not the tissue, not the body's human tissue. And that's is the concept that I can explain to patients, that this is how it works. And when you do it, it does work. It actually works very, very well. I've treated many patients with ulcerative colitis with the full resolution. In fact, there's a very funny story of a patient recently that I treated. And she had ulcerative colitis for about 9 years. And she was on the medications, sulfasalazine, for a long time. And then we started treating her with UBI. Probably in a month or 2 months, she went back to her gastroenterologist and got another colonoscopy. And then this time, the GI doctor said, look, your colon has got no ulcers. There's nothing going on. It's all smooth and nice. So it must be that you were misdiagnosed 9 years ago. Because they can't believe it. Because it's not supposed to go away.
Yeah.
And so the patient was like, right. And she just left the room. She said, yeah, I understand. You've been giving me the drug for 9 years. And now you have the audacity to tell me that the diagnosis was wrong, but you have been treating me for 9 years for this. So anyways, that was very interesting, a reaction from the GI doctor. But this is routine. The colonoscopy usually comes back normal.
So is there other IV therapies that you use besides UBI?
Yes, you can use practically anything. You can do vitamin C megadoses, 25,000 milligrams. You can start from there, or 50,000. And that you can do, so that the vitamin C helps also denature the viral DNA. It does denature the viral DNA. It's the best antiviral therapy. So you can do that. And then also, it also helps with the stress. So a person is stressed out, for whatever, because of the body situation or their, the environment, their living situation, whatever it is, the vitamin C calms down a person. It calms down because the only 3 places where vitamin C is stored in the body is only 3 places. One is the liver. So if you have a problem with liver, do the vitamin C. Or adrenal glands, which is where the stress hormone comes out, and the white blood cells. So logically speaking, if you're stressed out, vitamin C is going to calm you down. It's just people usually fall asleep during the vitamin C treatments because they're so relaxed.
I've actually had a vitamin C IV after I had a tooth extraction.
Yeah.
And now you say that, I do remember feeling pretty calm.
Yeah. Oh, it's very routine. I just observed this. They don't teach you this in any book or lecture or anything. I just observed the patient sleeping. I'm like, wow, that's pretty interesting. And of course, me, when I get vitamin C, same thing. I want to sleep. It's fantastic.
Is there other IV treatments that you use?
Yeah, we also use ozone treatment. We also do ozone, and we do it different ways. We do transdermally as well as IV. You can also do rectal for ulcerative colitis, but you have to be careful so you're not poking into the ulcer part of it. But you can do rectal You can do IV, you can do transdermal. So we have sauna, which is ozone sauna. So we have people put into the sauna and they can also feel relaxed. I mean, there's multiple therapies in there. It's not just ozone, but it's a detox machine. So we use it to detox the person's body. And that is very useful, very, very useful.
Mm. Have you worked with people that have had part of their colon removed and now they have a stoma?
Yes, I've had patients like that. In fact, I remember one patient, she was young. She was younger, like 26, 28 years old, something, very young. And there was, I think she was diagnosed with obstruction, some kind of obstruction, intestinal obstruction. And then what they did was they removed half of her colon, literally half of the colon, and then they transposed it. So the right side was now in the left side. And I have no idea why. And this patient was continuously had problems, never resolved. It was like almost 10, 15 years that she was going through different surgeries, this, that, whatever. She was never happy with her health. And then she was given to me as a patient that was like beyond any kind of resolution. So that was just like a challenge for me. And I like challenges. So I said, okay, I'll take it on. And so we just balanced her microbiome, like you were mentioned in the beginning. I said, let's just do the basics. We're just going to balance her microbiome and give her enzymes that she needs to digest her meals. Let's make her digest the meals. Let's get her the microbiome correct. And let's give her the right foods. That's it. Just the basics. So we did all of that. All her pain went away. She was able to eat. Wasn't a problem. So these things are very basic and very simple. There is nothing really extraordinary about what we're doing. It's just the basics of a human body.
Mm. So another thing that's often talked about in treatment by IBD is biologics. Could you explain what they are and whether there are ways that people can work towards avoiding them in the long run?
Right. I am a medical doctor. I don't use many drugs. Actually, I don't use any drugs, period. And usually when the patient comes in with biologics, usually the biologics is a new word that they coined in the last few years to kind of make it sound like it's something natural. I think it's a misuse of the word. It's to kind of confuse people about it's something natural, but it's not. It's an immune suppressant. So what's happening is that they're suppressing the immune system from even reacting. Is even reacting. It's like, you have an alarm system. The alarm is going off because the house is on fire. And now you want to remove the alarm so it doesn't bother you. This is literally what the biologics are doing, because they're just stopping in the reaction of the immune system to whatever they're reacting to. They don't know what it's reacting to, but they're just stopping the reaction. So how does that heal anything? That's the question that I always ask. It's like, how does that heal anything? It can suppress the symptoms because symptoms are coming from the manifestations of the immune system gone awry. And that's about it. But why is the immune system going off track? Why is it behaving the way it's behaving? That's not the subject of address with the biologics.
Mm.
Does that make sense?
Yeah, absolutely. Absolutely. That was a really good analogy. So what's next for you? What's on the horizon? Any exciting projects or new directions for you?
Yeah, there is many things that I'm getting into. And for right now, I'm studying peptides. Mm. There's also many peptides that you can use to heal the gut. So I'm studying all of that, and I'm going to get certified in that. And I want to use peptides for many, many, many conditions, especially the autoimmune. The autoimmune conditions can be addressed using peptides. But again, the peptide industry is also now being muddled up with the synthetic peptides, unfortunately. Like your semaglutide. They call semaglutide a peptide. It is a peptide because it's a sequence of amino acids, but it is synthetic to the body. the body doesn't recognize it because it's not part of it. So it's going to cause havoc because it's not natural to the body. So that's right now I'm in the process of eliminating all the fluff from the actual thing that I need to use for helping patients with autoimmune, especially autoimmune or even anti-aging. So anti-aging, there's many studies that have shown the good effects of different peptides that mimic, growth hormone or GnRH. There's different growth hormones receptors and different things in the brain, the pituitary and the hypothalamus, that are very important for longevity. And my practice is called Angel Longevity Medical Center. So I am totally focused now on longevity. Of course, we can help you improve the quality of your life to the degree that you want. And then we also want longevity. So now I'm getting into that a little bit more. I used to do stem cells. Maybe I'll get back into that. But peptides, I think they're less expensive, and they can be self-administered by the patient herself or himself. So I think it's more convenient, and you may get even better results. I don't know. I mean, I've done stem cells. They do help. But again, I think more research needs to occur in the stem cells area. So I don't feel too comfortable in trying to handle one particular condition. I mean, you can use it. I have used stem cells for myself, but peptides, I think, is a area. But again, you have to be vigilant that you don't want to be sold a bill of goods because they are not part of the body. So the best way to improve your health and keep it there is to avoid big pharmaceutical drugs as much as you can. Of course, sometimes you do need them. In an emergency, you absolutely need them, and you should use them to save your life. But in long-term chronic illness, I don't think they have a role except in an emergency.
Oh. Yeah. So, last question for you. Where can people find you online?
You go to just angellongevity.com. And that should pop up the whole information about what we do.
Great stuff. Dr. Anju, thank you so much for your time. It's been a real pleasure having you on the show, and it's been really great information as well that you've shared with the audience today.
Well, thank you, Lee. I've heard of you for a long time. It was a pleasure meeting you.
Yeah.
Okay. Have a great day.
You too. So that's it from me and Dr. Anju for this week. But make sure to join me same time, same place next week on the Radical Health Rebel podcast.
Thanks for tuning in. Remember to give the show a rating and a review, and I'll see you next time.